Papua New Guinea. I'm Malcolm Waira and welcome to another episode of Infocus. Tonight we hold discussions with the St. John Ambulance Service Chief Executive Officer, Mr. Matt Cannon. We discuss the organization's history, its mission, its vision, partnerships, and the challenges and its future plans. Matt, thank you for joining us.
Thank you for having me on the show tonight, Malcolm.
Firstly, can you give us a brief historical background of St. John Ambulance Service in Papua New Guinea? It's a brief historical background and its origins in the country. I understand it'll be celebrating its 40th anniversary this year.
The St. John organisation collectively around the world is 950 years of experience providing ambulance services and health services. So St. John was started in Papua New Guinea by the New South Wales branch of St. John in 1957. And before that, the St. John had been operating for hundreds of years in England and around the Commonwealth. The Papua New Guinea St. John Ambulance was formally established in 1976 when it was re-established in Papua New Guinea after independence as an Act of Parliament. So the St. John Council Act of 1976. And that's what established what we know today as St. John Ambulance in Papua New Guinea. And since that time, the organisation has expanded to parts of the country and at other times has retracted as the country has grown and economic activity has increased. The organisation in 1983 was appointed to operate the ambulance service for the southern region, and they did that in partnership with the Department of Health and also with the NCD Health Service as it was back then, and today what we now know as the NCD Provincial Health Authority.
Okay. Can you give us an idea of its core mission and vision in the country? And I understand you recently also launched your strategic corporate document. Could you give us a perspective on your core mission?
The core mission for St. John is to make sure that all Papua New Guineans can access emergency health care and receive good quality pre-hospital care, and to do that in a way that is affordable or free. And so 99% of the patients we transported last year received free emergency ambulance services, and that's around 21,000 patients that we helped in 2022 entirely free, so there was no cost. And that's in strong part of that is because of funding from the government and also sponsors from the corporate private sector.
Okay. It's good you mentioned government. I'm curious to know, how does your organization work with governments and other humanitarian organizations within the country to provide emergency services to local communities?
Well, look, fundamentally, St. John is a charitable organisation, so we exist solely to help other people. To help people like the fire service or the police service or the Defence Force requires funding. And St. John has different ways of being able to provide important services, and the government is the number one most important factor in terms of St. John being able to provide the services. Because fundamentally, the services are provided for the people, and that's a partnership with the Papua New Guinea government and the provincial administrations and health authorities. So St. John, the ambulance service is funded by the government, but it only covers about 70% of the actual cost of providing this sort of comprehensive service. So in addition, we rely on generating our own revenue. So rather than asking patients to pay a fee, which might not be affordable for some that are struggling, instead of asking for a fee, what we do instead is we raise our own money. And we don't want to go to private sector organizations always and asking them for donations. So instead, we've created an enterprise, like a business arm of St. John, that's designed to generate revenue for the organization that's used. 100% of that revenue that gets raised is used to make sure that the service is free and affordable for the majority of our patients. So that enterprise includes that we provide workplace first aid training for the big mining companies and the mine sites. We provide some private medical repatriation, so providing a team of a highly skilled team and well-equipped team of doctors and nurses that can medevac patients, people that need treatment overseas and have an insurance plan or privately funded. The fees that we generate from that sort of activity helps the public ambulance service, and also selling first aid kits and automated defibrillators. There's a big client base for these important devices. Every workplace must have first aiders. Every workplace must have first aid kits. And so our enterprise is designed to meet that need in the community. And in doing so, 100% of the proceeds from that help to fund the free ambulance service. So when people are critically injured or mothers are struggling to give birth, we can get an ambulance to them without any cost and do it as reliably and as quickly as we possibly can.
Thank you, Matt. We'll now take a quick break. Join us on the other side for more discussions. Welcome back. We continue our discussions with the St. John Ambulance Service Chief Executive Officer, Mr. Matt Cannon. Matt, recently the Papua New Guinea St. John Ambulance Service, it's officially opened its new emergency ambulance operations center in Port Moresby. How has that center improved your operations, and how is it giving you a bit more advantage in attending to emergency cases?
Well, fundamentally, it's a purpose-built facility that the ambulance service now uses to receive calls to the 111 emergency number and also coordinate and dispatch our fleet of ambulances. And intentionally, this centre's been put in Port Moresby to manage the calls from all around the country that come to St. John. So rather than having multiple different call centres scattered around the country where it's difficult to maintain the quality, difficult to maintain the training of the staff that work in there, having one centre is the perfect solution for us. The challenge that comes with one centre is how do we communicate with ambulances that might be on the other side of the country in Wewak or in East New Britain. And so we've embraced a technology from this facility to be able to communicate with ambulances around the country. So we're harnessing what's called a radio over IP, which is where we're using the traditional mobile phone network, 4G LTE, to be able to have that transmit radio type chatter. So you can hold what looks like a radio and talk. And instead of that being a radio frequency that uses like VHF or UHF, this uses LTE. So it transmits as a data package, and it enables us to have radio coverage wherever there's mobile phone coverage. And with that system, we can now have the calls coming directly to our operations centre. With this new facility, we've got a state-of-the-art communications network in there that, as I mentioned, allows radio talk to all the areas around the country where there's mobile phone reception. And in addition to that, we've looked at technologies for faraway places that are not within coverage of mobile phone, where we're utilising satellite radio and HF radio in some locations. And this new centre, it builds upon our existing computer dispatch system, so that when you call, you'll speak to a phone operator, and the phone operator needs to confirm whether you need an ambulance. That's the first thing that happens when you call. Unfortunately, we get around every day 4,000 nuisance calls. So this is people that have dialed one of the emergency numbers and it's come to St. John, and these people are wasting our time. So they'll call, they will use language that's unacceptable, or they'll make stories up, or they'll tell stories, and this wastes time. And constantly we get feedback from clients they're having difficulty getting through to the operations centre, and it's because these time wasters, people dialing emergency numbers, being a nuisance to everyone, are tying up the lines. And that's something that we challenge. So the first point is that you'll be asked to verify that you need an ambulance. And then if you require an ambulance, the call will be transferred to a call taker. And a call taker uses a computer with a script or a list of questions that they need to ask you. Now, once they've asked the first 3 or 4 questions, if it's identified that the emergency call is about a life-threatening situation, automatically that information is sent to our dispatcher. So while the call taker asks more questions of you, The dispatcher sitting a few meters away on another computer is arranging an ambulance to get to your location if we have one available. And this all happens simultaneously using a system called computer-aided dispatch. And it's used in emergency services all around the world. And similar to the fire service here in Papua New Guinea, we have a computer-aided dispatch system. And that dispatch system, it can also talk to our ambulance crews and see their location. So once the call taker has got all the key information that they need, they're going to continue asking a series of questions, and that information that they're asking afterwards can be relayed to the ambulance officers so they can prepare before they arrive at the patient, prepare in their mind what they might need to do for the patient. It also serves as a secondary triage, these questions. Is the patient bleeding? Which arm is injured? Which side of the body? These sort of questions I'll ask. As I mentioned earlier, we have a dispatcher. There's a dispatcher, one on each shift for NCD, another one for regional, and another one for our operations support. So these dispatchers, their job is to coordinate and dispatch the ambulances. And they have a list of calls, emergencies that we've been asked to attend, and the computer system will automatically prioritize those by the most life-threatening down to the least life-threatening problem. And constantly, as we're getting more calls, those might shift around. So if we have a few emergencies coming in and then someone calls with a child that's drowned at the beach, that will become the highest priority. So if we have ambulances responding to lower priority emergencies that still might be urgent, but this is now an absolute life-threatening risk, which is drowning because the child is perhaps no longer breathing. So that'll become our highest priority, and the dispatcher can divert ambulance crews to those cases. So our dispatcher uses, as I mentioned, that computer dispatch system, but it also, the dispatch system will talk to the radio and the pager that the ambulance officer carries. So it will send them a message with the location, and it can even bring up a GPS coordinates of where the casualty is located. And that's how our operations centre works. So state-of-the-art technology, and its primary focus is to try to prioritise and get ambulances as quickly and efficiently to the patient as is possible.
Are there plans to replicate similar operation centres to other provinces as well?
No, there's not, and we don't want to open more operation centres. Our view is that we having one centralised location is best practice, and as I mentioned, we can now coordinate location. We will in future look at having backup operations centres, and that might be a discussion in years to come where that backup operations centre will be. But in terms of the primary function, that will be, we would prefer to have one centralised location.
As you mentioned, it's quite a very technical field, set of operations you run at the headquarters. I'm curious to know, what is the total number of men and women that's currently serving within the St. John's ambulance service, and how do you recruit and train them for the specific roles that they have?
We employ around over 300 men and women, the operations that we provide around the country. Those men and women, predominantly the largest single workforce is ambulance personnel. And those ambulance personnel all are recruited. They go through mathematics and English testing, as well as reference testing and interviews. And when they're recruited, they go through a basic training. Now, basic training starts at 1 week at the ambulance college, where that if you finish that 1 week course, you qualify as a first responder, so you can be able to volunteer with us. All the ambulances have a professionally trained ambulance officer on board. So these are people that are paid by us. And that course is typically around 16 weeks. So we have our reservist course, which is around 2 to 3 weeks, and we have our professional ambulance officer course, which is around 16 weeks of training all up. So just over 3 months in the classroom at our college at our Ambulance Service Training Academy in Port Moresby. And that training teaches them the skills to provide advanced first aid, to provide advanced resuscitation, to use oxygen and nebulizers, as well as to use defibrillator to measure pulse rate, respiration rate, temperature, breathing, and all these important vital signs, as well as using splints and other bandages and tourniquets to prevent any sort of further damage or loss of blood for patients with limb injuries or other such injuries. So that's all taught to them in the college, but they also learn about scene safety, providing emergency care in dangerous situations, using communication radio devices, and we're also incorporating driver training into that so they can operate the ambulance in an emergency. And all that comes together in a 16-week package, and then after that they spend around the next 9 months working on an ambulance under the supervision of a qualified ambulance officer, where they're supervised and they continue their training throughout. And then once an ambulance officer becomes qualified, their training doesn't stop there. So they need to be recertifying every year, and they've got to do around 72 hours of training each year as a minimum to maintain their authority to provide the ambulance services. And look, in addition to that, we've got professional registered medical professionals and practitioners that work with us, health extension officers, nurses, paramedics, doctors that work on the ambulances or work in rapid response vehicles and can go and provide a higher level of care at the scene. So each of our stations has a clinical team leader, and that's usually a nurse or an HEO that's completed their advanced life support training and other things to provide a higher level of emergency medical treatment to the patient when they're injured.
How have you found the interest from applicants to the particular training programs you offer?
Look, we've had tremendous interest from the community. The challenge is our success rate for applicants is only 20%. So only around 20% of people that apply to become an ambulance officer meet the requirements to become to progress to the training phase of their application. Predominantly, the area that we see as being the biggest challenge for candidates is the English testing, and we see around an 80% failure rate on the English exams, and this assesses the students at what should be a grade 12 level, no less, as an English exam. So we'd say that if people are applying to come, they need to make sure that they've prepared for English tests and done as much. There's plenty of courses online, many of which are free, that people can use to prepare themselves for these things. But our protocols and our training is all in English, so it's very important that that's a benchmark that the recruitment team use.
Thank you, Matt. We now take a quick break. We'll be back on the other side with more discussions. Welcome back. You're watching In Focus. We continue our discussions with Mr. Matt Cannon, Chief Executive Officer for the St. John Ambulance Services. Matt, you mentioned some of the challenges the organization is confronted with in the country. Could you give some specific challenges that has confronted your organization?
Some of the bigger challenges that are there is supply and demand challenges around the number of emergencies that we get called to and the number of ambulances that we're able to staff each day. And right now we see we have more calls at any one time than we do emergency ambulances available to respond, and we need to increase the number of emergency ambulances that we can staff. And it's not just about buying more ambulances. It's about also being able to factor in the cost of staffing and operating and fueling and repairing and maintaining those ambulances, because a vehicle in itself can't help anyone, but a vehicle with the right team and a vehicle that's in a good condition is able to help people. And that's one of our big challenges. And an example is Lay City, where at any one time we might have 3 or 4 emergencies waiting, but only one ambulance staff funded to be available 24 hours a day. We have 3 or 4 ambulances themselves, but we only have the funding to operate 3. And unfortunately, it means that many people are waiting sometimes hours for the ambulance, and that's something that most frustrating for everyone involved. And especially for the ambulance teams that just want to be out there helping these people, but they are so busy that the demand the ability to manage the demand at the moment is stretched at times. Some of the other factors that are difficult are road access, as we mentioned, and the conditions of the road. We need to spend around 20,000 kina a year per ambulance on maintenance. Now that ambulance might help 5,000 people in a year, and it costs 20,000 kina just to maintain and service it. And every 5,000 kilometres, we need to have it serviced. Now, a typical ambulance will travel 60,000 kilometres in a year. And so you can see with that simple maths that we're servicing these vehicles, having to send them in for an A, B or C service every month. So a vehicle is off-road sometimes for a week every month. So it's very important that we have enough ambulances to be able to cater for the fact that 1 week it'll be off-road having a service performed. So road access is a challenge, and this affects particularly our mothers and children, newborns that can be several hours away, and particularly if mother's suffering a maternal emergency, a childbirthing emergency, such a long period of time can have drastic effects on survivability of mum and baby. Some other challenges that we face, we spend around nearly 50,000 kina a year repairing ambulances because usually young men in particular, are throwing rocks or slingshots at the ambulances, damaging the equipment and also the windows. And so 50,000 kina a year is a considerable amount of money that we could be spending on much more useful things that could be put towards helping save lives in the community. So that's one thing. We also see the opportunities as well to be partnering more closely with the Royal Papua New Guinea Constabulary and the fire service, so that we can provide cross-training, so that if police are first to arrive in an emergency, they can be trained to render immediate first aid care to the casualty or the sick person. So these are some areas that we see as opportunities, but also challenges.
You mentioned the support you get from government, and you also have quite a significant support that comes from the private sector as well. Could you give us a perspective on how critical private sector support has been, and give us examples of very key partnerships which you've engaged with the private sector in the provisioning of emergency services?
Look, we've had fantastic relationships and support coming from the private sector in particular. As I mentioned earlier, our operation is about 70% of the cost of the ambulance service is covered by funding from the government, but there's still around 30% or around 5 million kina a year that we need to generate ourselves. And if we've got options with how we generate that revenue. We don't want to be charging vulnerable patients fees. It's just beyond their ability to pay under the circumstance that they're in. So the last thing we want is people to be financially burdened because they call an ambulance, and that's why it's so important that we can generate some additional revenue to fully cover the cost of this 24-hour service. And that's where the government funding is so crucial to being able to provide the core service, and that extra funding that we generate mostly comes from workplaces that choose to have all their employees trained by St John Ambulance in first aid. And that helps us generate sufficient revenue to be able to keep the ambulance service operating. But also businesses that are choosing to buy first aid equipment, kits and defibrillators, and have those available, not only helps with the funding for the ambulance service, but it also means that when the ambulance turns up, there's a greater chance that the person that's had a sudden cardiac arrest or becomes sick or injured at work is going to survive. So it makes our job easier in both respects. People that are trained in first aid, that render first aid quickly, are able to improve the likelihood that the casualty will survive and be able to make a full recovery. And that's just how it is. And that's why that first aid training is so important, the double benefit of it in communities. But we are very fortunate that we have strong partnerships, particularly with the Brian Bell Group and the Sir Brian Bell Foundation is one of many great examples of partnerships that we have. And the Sir Brian Bell Foundation has, over the last 5 years, supported the First Aid in Schools program. And this is a program that St John delivers, and it's fully supported and funded by the Sir Brian Bell Foundation. And that helps us to travel around to high schools, around NCD, Morabay, East New Britain, Chimbu. This year we'll also reach Madang and I believe East Sepik as well. And grade 9 students receive a full day of first aid training in a range of emergency situations, how they can manage those situations themselves using tools and equipment that might be available to them at school or at home.
Unfortunately, we'll have to leave it here. It's been a very educative and comprehensive discussion. Before we go, I'd like to take this time to thank our special guest, Mr. Matt Cannon, Chief Executive Officer for the St. John Ambulance Service. Matt, thank you for coming.
No, look, thanks for having me on the show today. And we just on Saturday, the 24th of June, we'll be celebrating 40 years of ambulance services in NCD. We're an organisation that's been part of Papua New Guinea for 66 years, and this year will be 40 years of the ambulance here in NCD. So we're looking forward to it being a great celebration and an opportunity to thank the so many people that support the ambulance service in many ways.
Thank you, Matt. That's all the time we have for this edition of Infocus. Thank you for joining us, and until next week's edition, good night from us.